Well, it works with GLP-1s. We have receptors in the brain and they work on the reward system. So it's like the hedonistic part of your brain that desires things and wants things. So I feel, well, they're actually going to come out with a drug. I think it's either Novo or Eli Lilly with another name, but similar. It's, they like to name the same things and give it a different indication, but where they are going to use it in addiction medicine. And I think like what we're learning more and more about addiction, it's different tools in the toolbox, like where they use naltrexone because it's a partial agonist on the opioid, and same thing with Subutex and Suboxone. But I do feel, because I truly was a food addict with a horrible eating, like binge eating disorder, and I don't do it. It changed the way my brain desires. It's not going to be for everybody, but I think a lot of my patients, at least with alcohol, especially, that's where I think the indication is going to come out for alcohol to just help with calming that desire. Of course, there's all the, AA has been very effective, but, many other tools that are in the toolbox to aid in that addiction behavior. But I do think that there's going to be more important research coming out about using the GLP-1s, and as the new iterations come out to help with addiction. So I'm very hopeful on that. And I actually did at one point, because diabetes is my specialty. I had wanted to do that with my boyfriend. I did. I was like, maybe I just thought, you know what I mean? He didn't need to lose weight. You have to understand, forget about the weight. It's how it worked on the brain. I mean, I will never know that answer to that question if it would have made a difference. And I think there was many deeper stories there, but I'm interested to see. Well, I think it's a wait and see kind of thing, but I do think they're definitely going to be used in addiction medicine.
Yeah. Anything you'd like to say to round things off, Gabriella?
I just wanted to say that, addiction and any type of disease, medication is just one thing. Another thing is the emotional, the mental health support, and also to have a community of people and to look at the person as a whole, from a whole health perspective. The person is not just disease. They might have a disease. They also are a living, breathing human being. They have an environment. They have a place they live. They have a family or don't. So, look at a person, look at all the layers.
Yeah.
Not just look at a cardiac condition, not just look at an addiction condition. Look at the whole person and look at every step what we can do for prevention and wellness. Because the more rounded the person, the more support, the more community, the more wellness, the more environment and nature and all these kind of things we can bring in, and mindfulness and meditation, they are all part of it. Sometimes the simplest thing we can do is just help the person pause and breathe, because we forget in this running crazy society to just breathe. And that could be just such a calming thing that they can say no maybe for the next, time they go out and want to have alcohol or something else, because they feel that there's other people to connect. There's other things that are important in their life. I think many people get in this cycle in society and forget to pause and kind of connect with themselves and what they want in life. So the more we can help people do that, I think the better off we are going to be.